Okay. Well, how you doing, guys? My name is Mike Smith. I'm the owner of GMH Get More Hair, safe, affordable hair transplants for everyone. And in today's very special Zoom video, I'm joined by the one and only, the man, the myth, the legend. I call him the GOAT, the greatest of all times. He is Dr. Levent Acar. Dr. Acar, how you doing, man?
Thank you very much, Mike. Thank you very much. Everything is fine. We stay at home and just waiting at the other side. We know the situation.
Yeah, baby.
Everything is fine. Thanks God.
That's all good, man. That's all good. And our special guest tonight, and I mean our special guest tonight, looking pumped up like some sort of Captain Universe over here, is the one and only, the very lovable, and I've got to say, what a lovable guy, the one and only fantastic Mr. Tom Powell. Tom Powell, how the hell are you doing?
Oh, thank you very much. Such a lovely introduction. I'm doing very well, thank you.
You're looking good, Tom. I've got to say, looking very good, man.
Thank you very much. All down to you.
That tan looks incredible, Tom. I've got to say, is it real?
It is actually real. It's been sunny in Wales for the first time ever.
Well, there you go. You've heard it here live, guys. You've heard it here live. Well, look, we're here tonight with the doctor and with Tom, and we're going to have a little chit-chat about Tom's journey, how he is, how everything's going. Before we do that, we just want to acknowledge all of the fantastic key workers in the UK. As you know, we're having issues with this COVID-19 at the moment, and we've got doctors, nurses, carers, not only doctors, nurses and carers, but we've also got people that work in a supermarket, extremely important delivery guys, postmen, everyone that's got to go to work that's doing a job. We just want to say a big thank you, massive respect to you. From me, Tom, obviously, and the doctor. God bless you all, man. God bless you all. Okay, well, look, Tom, the question everyone wants to know is, how are you? How is your hair? And how comes you look like, you know, you've been chiseled out of stone? What's going on? Everyone's getting fat apart from you.
My hair is absolutely fantastic. You know, I've actually got a hairline for the first time in about 5 years.
That looks crazy good, man. That looks crazy.
Honestly, I can't, like, look how thick it is.
Awesome.
It's unbelievable, absolutely unbelievable.
So is it fair to say that it's met your expectations, Tom?
Oh, it's exceeded.
Really?
Yeah, I didn't really know what to expect. I'd seen a few hair transplants beforehand, a few good, a few bad. And obviously in the first few stages, you're not sure how it's going to turn out, because obviously with the blood and all this, you're not sure how this is going to be in 6 months' time. But then everything that you said, just wait till 6 months mark, wait till the 6 month mark. And now the 6 months mark is here. I can't believe that you were right about everything.
Yeah, man. Well, the thing is, Tom, I do remember that you was going to go with another hair transplant company in the UK.
Yes, I was.
I'm not going to mention their names, let's not mention them. And I personally, I don't want to get into it, but I mean, was you happy you went with us as opposed to them?
Massively, absolutely massively. I can't thank you enough for convincing me to come with you.
No worries, man. We've been very happy to have you. So, Doctor, do you remember Tom's surgery? Because obviously,
yes,
the hair channels, you've done the surgery. Is there anything you remember specifically about Tom's surgery? How did it go? Was it a good surgery, hard surgery, easy surgery?
It was so. Tom is a very, very well-known person, and he's on the front. So what I imagined was he get like receding hairline on the corners, and it was a bit up. It was a bit up, so you cannot style your hair how you want. From what I remember was about, and this was very important. And
yeah,
it is not easy to get a natural hairline and a same density as your existing hair. So this is very important. If you make the transplantation, for example, on the corners, and if you lower the front line, you have to get the same density as on your existing hairs. Then it looks complete, like a complete one look. This was very important. That's why, Tom, we make a very fine work. It was a very, very sensitive, very fine work. It's very small instruments, but I'm very happy to see your result now.
Yeah, I'm really happy as well. Very, very happy.
And the other thing is, of course, I'm sure you support your hairs very well. And as you remember, we speak about aftercare support, because hair transplantation doesn't support your existing hairs. It is very important to use at the same time the vitamin tablets, Density Plus, to make sometimes like twice a year or once a year PRP, the plasma injection, to the
Yes.
existing hairs and transplanted hairs. Finasteride is my favorite tablet, but I know you are a muscle man, so it is
Yeah.
not easy for you to use it. But it is
Yes.
also very important after then that you support your transplanted hair and more important, your existing hair. But let's say if it's happened, if you get a hair loss after 10 years in your existing hairs, we are able to fill it. We are able to fill it, so you will get any time of full coverage.
So in other words, Tom, you're completely and fully insured. You can come back any time you like. You've heard it from the doctor. It'd be great to have
Fantastic
you.
news.
So Tom, can I ask? Okay, so let's start from the beginning, right?
Yeah.
We contacted you on Instagram. We said, "Hey, Tom Powell, we know who you are. Fantastic. You chiseled out of stone. You're a good-looking guy. We didn't realise just what a nice guy you was, to be honest with you, Tom. Because
Yeah.
I don't want to embarrass you, but one of the things, and I'm not trying to blow smoke to you, but I just want to say to the guys out there, what a nice human being. And when, like I said, when we reached out to you and we said, "Hey, would you fancy this? Would you be interested in this?" And you was kind of like, "Well, I would, but I'm talking to another firm and blah, blah, blah."
Yeah.
It must have been quite a bit of a leap because obviously, you didn't really know us. Our brand was out there and the doctor's been around for many years and whatnot. But we basically said to you, "Don't go there, come here."
Yeah.
When we met you I remember I met you in Turkey. I met you at the airport, at the brand new airport, and we had a coffee. And how did you feel when you got to the hospital? Did was your, because it's a very big thing to have done, and I can imagine a lot of people are nervous. But you seem very cool, like you weren't phased at all, Tom.
No, I was, the night before, I was a little bit phased. I was a little bit worried. But seeing the hospital, that was when I realized there was nothing to worry about. The day before, just being in Turkey, and obviously I was by myself. So all you had to do was with your thoughts all night. So all I did was think, what could go wrong? But then the second I got to the hospital, it was like a 5-star hotel, the cleanest place I've ever been in my life.
Nice.
And realized that this was proper and there was nothing to worry about.
Yeah, man. And with your surgery, Tom, you was one of the first kind of phase of guys that we started doing the new DHI method on. I'll hand you over to the doctor because DHI is the brand new thing that the doctor's doing, and it's not just regular DHI. It's his own. We call it a hybrid version of DHI. So they extract with the traditional FUE method. So and then open the channels with a micro sapphire tip blade. So it's a tiny blade. But it's when they implant the hair follicles back, they put them into this implanter pen. 360-degree protection, higher graft survival, a lower healing time, and faster results. So, doctor, how did you feel when you done Tom's surgery? Because obviously we're using this brand new method.
Yes, we use this method about 2-3 years, Mike, DHI, and especially if we speak about the density, if you want a really good proper density with the highest success rate, we use the micro sapphire blades and the implanter technique, which you tell it's make like 360-degree protection. Because if you implant the hair follicles wrong, you get lower density because you are damaged some hair follicles during this manipulation, during the implantation. That's why I have to say I'm very happy with the success rate with the DHI Sapphire combination. And I recommend to everybody, if you want the maximum result, if you want to save your donor area for a possible future session, maybe after 20 years, we don't know, maybe never, maybe after 10 years, then just use this best technique because this is a lifelong result. This is not something you can do every time. It's not something you can cannot take hairs from other person. It is what you have. It's what it is. So that's why just do the best, do the best, and you will get perfect success.
Fantastic, man. And Tom, because we see like what we're seeing is faster results. Now we know your results come through pretty quick, right?
Yeah, I think you told me that to expect it after 6 months, and after the 4 months mark, my hair was like this. My hair was full after 4 months. It was crazy.
This is what we expect. You know why this happened, Tom? It is very interesting. So smaller the blades are, so smaller instruments you can use, so faster results you are seeing. This is true, because the body is it's everything is about the body support. If you damage the body too much, so the body takes more time. It needs more time for the healing. If you have less damage, the body can support it better, faster. So that's why we're trying to decrease the size of all the instruments what we have as maximum as we can.
Less impact.
Yes, less impact, but it's not easy. If you make the hole too small, so how you want to implant it? That's the question.
So if you make the hole too small, you can't get you plant a pen in.
Yes, so how? That's why you have to improve everything, every step: the extraction, the incision, the implantation technique, and you need a very experienced team for that, because this is a teamwork. Yes. So smaller, so less traumatization, so better. This is for everything.
Yeah. Tom, did you realise you'd had this very latest technique done?
Yeah, you did say that I was going under for this new surgery, and now I'm landed. I had it done. To be fair.
So Tom, do you, like, when you look at, like, I won't mention the celebrities, but I had a bit of a row with one celebrity on Instagram, and you look at their hairlines, it looks like they've been sewn in with a crochet needle.
Yeah, you can tell people have had it done, and now me and you have had a conversation about it, and you've explained it. I can spot on Instagram who has had it done and who hasn't.
Instantly,
literally instantly. It's crazy. Yeah. But anyone that I've met in the past 2 months doesn't know that I've had it done.
Nobody knows,
unless I bring it up. No one knows at all.
Yeah. And do you know what, Tom? One of my little tiny pleasures in life is telling people I've had a hair transplant, and they go, "Huh?"
Yeah, and they look. They want to see it all. Yeah.
Really, where have you had it done? And I'm like, "Look."
And then the second question they ask after see the front is ask of the back.
Yeah.
And then they touch the back, and I have no marks whatsoever. You can't feel it. You can't see it. It's like just a normal head of hair. And people are shocked that you can't even tell that I've had it done at the back as well.
Yeah, man. But this is what I say to guys because I do obviously the YouTube videos, I do Instagram with all this stuff, and I promote it. And I say to guys, what you need to consider is, it's not like buying a car or a TV. No. It's not like every place is the same. Different clinics, different skills, different techniques, different. The people that run the clinics, they've got different visions of what is a good hair transplant. Now, there was a forum that we support, a forum called Hair Loss Experiences, and there was a situation on there where there was a UK surgeon, and she posted some results on this forum, and the community just sort of laughed, and they were really, saying, just speaking honestly about this hair transplant. They said it looked awful and fake, and as she turned around on this forum and she said, what's wrong with all of you? What's your problem? This is amazing. Because she thinks that's amazing. We're at the cutting edge of hair. Tom, I'm telling you, we're at the cutting edge. See this man, Dr. Acar, believe you me, I know he doesn't like me saying it. I don't want to embarrass him. He's a visionary. And he's like, I eat, sleep and breathe hair transplants. And when I speak to the doctor who does hair transplants, that's all he does. That's all we talk about. I'm surprised he doesn't turn around and say to me, Mike, can we just stop talking about it? But he's always so passionate. And I'm a big believer in this. Really do your research. Go to the right clinic. Go to the right people. And Tom, I'm so glad you come to us, because it's such a fantastic, from start to finish. It's been terrific. Now, Tom, what month did you come over, Tom? I can't remember.
Neither can I. September. I want to say...
End of summer?
Yeah, October. August, September, I want to say.
Yeah. So you're still not at 12-month result?
No, I think I'm touching 7 months now.
All right, let's have a look. I'll see if
Tom, when do you start? Because this is a very popular question for people who make sport, who are very active on fitness.
Yeah.
When do you start again for the fitness activity?
Be honest, Tom. Let's be honest, Tom. When did you start training?
Yeah.
How many weeks after surgery? Because we see you on Instagram, Tom.
Yeah,
Come on.
I think I lasted 2 weeks.
2
weeks.
It's good.
I think
it's
I
fine.
lasted 2 weeks.
Do you start very heavily or just like?
No, I started with. You said try not to sweat, try not to bring your blood pressure up. So I did low intensity.
Yeah, perfect. Because it's not easy, and we have a lot of our person they like sport, and if you tell to them you cannot make sport for 1 month, they get very upset.
Yeah, it was difficult. The 2 weeks, I did nothing. I did walk, and what I did, instead of exercising, I made sure I hit 10,000 steps a day.
Yeah.
And that was quite easy to do because I was still kind of active, but I wasn't raising my blood pressure.
My other question is, because muscles are very important for you, and as I remember, we don't recommend I don't recommend you to use finasteride.
No.
Instead of that, if you want, maybe you can take the organic fruit extract tablets, saw palmetto.
Yes.
Am I right? Have you take it, or do you just maybe for future?
Yeah, no, I took it. You give me them, and I took it for about 2 months straight. And you give me finasteride as well, just in case.
Just in case.
But I haven't needed it whatsoever.
Okay, perfect.
Well, Tom, I can confirm you had your hair transplant done on the 10th of June.
10th of June, oh, there we are.
Yeah, it was
That's
summer.
flown by.
How about that, man? How about that? So, with regards to the, 10th of June, what are we now? We're April, May, June. So you're about 10 months in.
Yeah.
Okay. How, when we talk about your expectation, Tom, and your results, was you expecting it to be as sort of thick and as kind of as it is?
No, I didn't expect it. And the main thing with me is I didn't expect it to come through so quick.
Really?
Yeah, you always said, and a lot of people, because
your hair come through like poof, didn't it?
Yeah, and I asked a lot of people as well, and they always said, "Oh, just wait for the 12-month mark. Wait for the 12-month mark. Wait for the." Or everyone said it, but after 4 months, the difference was crazy, and then after 6 months, it was a full head of hair, and you could not even notice a difference after 4 to 6 months. And from everyone else that's had hair transplants across the world, say in 12 months, for my time to be half that, I was amazed. Absolutely amazed.
The funny thing is, Tom, I'll never forget when you turn up and you had bleach
blonde hair.
No, I'm thinking, oh mate, and I've messaged Levent. I'm like, Levent, his hair's bleach blonde, and Levent, he's as cool. Let me tell you, man, he's as cool as a cucumber. And he's like, don't worry, Mike, don't worry, don't worry. And you had a quote unquote no shave hair transplant, right?
Yeah.
But I remember when you had it done, you looked like some futuristic warrior.
Yeah.
And it didn't.
Yeah.
It's like a partly shaved hair transplant. We just shave the donor area where we need the permanent hair follicles, and we leave all the existing hairs. It is good. I think this is also important for people who need to go very fast through social life. Who are on the front of the camera. It is an advantage also,
Yeah, that's what it was. The fact that you could leave me with some hair so I could style it whilst it was recovering, so I could sort of still be in the public eye without thousands and thousands of questions, which was fantastic.
Yeah. This is important. And it's also important in the flight, during the flight, in the airport, nobody can notice it. After 3-4 days, it comes almost even.
Yeah.
So Tom, how did you find the first week? Because really, the surgery, you was comfortable. I mean, I know you didn't. To be honest with you, Tom, you didn't grumble once during the surgery. You was.
For anyone that is scared about the pain, tattoos hurt more. I would rather get 10 hair transplant and 1 more tattoo. Honest to God, I can't, like, I was scared about the pain because I'm not great with tattoos. Tattoos hurt. But tattoos are 10 times more painful than this. And I was sat there, how long was I down for? 7 hours,
Yeah.
I think. And I would happily do that 10 times over than have another tattoo, that pain.
Really, Tom?
Yes, 100%. I can't explain how much it didn't hurt.
Well, so basically what happens, Tom, is obviously I'm just reiterating. When you have a hair, okay, so when you come to Cosmedica, you come into the clinic and we do the, chit chat and we do the what do they call it? The consultation.
Yeah.
The consultation with the doctor, and then we give you a Xanax.
Yeah.
Okay, so the Xanax calms you down a little bit.
Massively.
Massively calms you down. And then you had the needle-free anaesthetic where they...
It just felt like a little elastic band flicking you.
Yeah.
That's all it was, a little elastic band. And then from there on, I couldn't remember a thing. The next thing I remember was, I must have drifted off because the next thing I remember is them waking me up saying it was lunchtime.
Yes. Well, that's the thing, Tom. A lot of guys don't realise, like they say to me, the doctor didn't come in. Oh, they didn't give me PRP. They didn't, you don't realise you're drifting in and out of contact. Because we also, some guys, like with yourself, we put a cannula in your arm and we give you a little bit extra medication just to make you a little bit more comfortable. And we had Liam McLeese, Liam?
Yeah.
Liam was snoring like a lion. He was like a giant lion. I said to the doctor, for God's sake, don't wake him up. Please don't wake him up, man. It was, you just don't realize. And time kind of, what I want to ask you, Tommy, did it feel like you was in surgery for, say, 7 hours?
No. Like the first half of the surgery when he was doing the back of my head, I think I slept through the whole time. I had lunch halfway. I must have drifted back off. And for the last hour, whilst they was doing it, I was in no pain at all. I was managing to play Candy Crush on my phone.
You were playing Candy Crush?
I was playing Candy Crush on my phone. That's how little pain I was in. Honestly, that's how little pain I was in. I can't explain. It didn't hurt.
Yeah.
Thanks to needle-free anesthesia, it is really a very comfortable treatment. Before we use needles, but I know that many people, even 5 years, 6 years before they have a hair transplant, we are getting in contact with them sometimes, and they tell us, I cannot forget the pain with the needles. And after then, we really make a lot of research to stop these needles because so much pain. This is a bad feedback for your clinic, for your people. Don't forget it even after 5-6 years. But thanks to needle-free, it really works. It reduces the pain up to 70%, which is a very huge number.
Yeah, thank God.
Sorry, guys. Can I just say that I had 2 surgeries with the fantastic Dr. Acar. Look at the face. Just zoom on Dr. Acar.
At that time, we don't have the needle-free.
Hang on a second. The second time you had needle-free, I think I missed it. But let me tell you, it is not. This is what I say to guys. You're not going to get post-traumatic stress. You're not going to have to go and see a counsellor. But it is. Every time they inject you, it's like an intense, like a wasp sting or someone's putting a cigarette. It's an intense burning. When I had it done, it was not great, and it's just not great. But it doesn't last forever. It doesn't last, even with the traditional needles. It doesn't. Once your head's numb, they could throw rocks at it. Numb.
Yeah.
But the needle-free, what surprised me when we started doing the needle-free was the feedback from the guys, especially guys that had had a previous surgery with traditional needle. They was just like, it's a breeze. We done Callum Best. Callum Best, he was, I think he was a bit anxious before because he's had 3 previous surgeries. And then when he had this one, I never forget, he said to me, that was a breeze. That was a breeze. How did you feel, Tom?
Exactly that. It was not painful in the slightest. It was like I could do it again now. And if you said I have to come back and do it again, happily, I would jump on a flight tomorrow and not be phased.
Yeah, I mean, like I say, the thing is, Tom, it's things have changed now. Technology's moved on, and especially now with this new DHI that we're doing, I've got to say, Tom, like I've been working with the doctor for approximately, I'd say about 4 years now, maybe 5 years, and I've had my hair transplant 5 years, and you know, I've all I've done is eat, sleep, and breathe. This DHI method, I don't want to big it up too much because I feel like I'm going to build guys' expectations up. But the results, doctor, the speed at what they come through. Yeah. I mean, take over, doctor.
Yes, it is. We get higher success rates. This is true, and especially on very difficult parts like the crown, because the crown is, for example, the most difficult part of the body support of the blood circulation. But with this combination, with this hybrid method, we get the expectations. Yeah,
it's crazy, and the results, Tom. The healing time, like when the doctors first started doing this DHI, the healing time was the first thing for me. I couldn't believe how quick guys were healing, because, like the doctor says, you're making less impact on the head, right, doctor?
Yes. So smaller we make the damage, we have to make micro incisions, pre-made incisions. So smaller they are, so faster the body will support the healing, and so earlier we can see the results, and so better densities we can get. This is true. This is what we see in our treatments. Especially we can see the difference between like 2-3 years before and now.
Yeah, it's crazy, man. And like I said, Tom, you was very fortunate where you've had the brand spanking new. Well, we say it's brand spanking new because now we're really starting to promote the DHI. So, Tom, how has your styling of your hair changed? Now you've got this new hairline. Now it's lower.
Oh, massively. I've gone from the 6-month mark. I shaved it all down to, I think it was a number 3 or a number 4 all over, just to show off my hairline, just so people could see, yeah, I've got a hairline. Now I'm deciding to grow it because I want to slick it all back. I've never been able to slick it back in, like, I haven't been able to do that since I was about 10 years old.
It's crazy, Tom. Is it, you know, is it like I said, it's something I never thought that would be possible. I see my dad go bald. My dad lost his hair, and he used to say to me, wait till it happens to you. And I used to think, please, God, let them invent a tablet or something that can help this. And then sure enough, you know, just in the nick of the time, I met, you know, the greatest of all time, the GOAT, Dr. Levent Acar, and my life was changed. So you are good about it. It was a, you know, I don't want to put words into your mouth, Tom, but it was a positive experience, and you're happy that you went through it. Yeah?
It's not just a positive experience, it is a life-changing experience. I think I've worn a hat 3 times since surgery. Since my hair's come back, I must have worn a hat 3 times, maybe at max. I can get out of bed, go to work like this, and not worry about it. It's caused me so, like, there's no stress in my life over this anymore. I used to constantly think about my hair and how my hair was looking. Now I'm not worried about it ever, and it is generally a life-changing thing.
Well, fantastic, man. Well, Tom, we can only say thank you for obviously, you know, being one of our ambassadors, coming to us at Cosmedica, GMH, and choosing us over, like I said, over the other clinic that I know you was pretty set on. And you know, it's wonderful to see people's transplant results. I'm so happy that you're happy more than anything. I'm glad that things are okay in the wonderful Wales. And doctor, let me just explain to you what Wales is. Wales is like Britain, but the men look like, the men are like this. Okay? Sorry, Wales is like England, except men are like this. As you can see, Tom is a big boy, and it's from Wales we get the best. I know that you like lamb, doctor. right? You like lamb?
Yes. Yeah, of course.
Welsh lamb is, you know, it's
best.
famous to be the best lamb in Britain. It is the #1 lamb, and it's not just lamb they produce. They was great miners' rights from in Wales, and
Yeah.
they've fantastic history, a fantastic culture, and they speak their own language, Doctor. They speak their own Welsh language, which is
Some of us.
spoken today. Do you speak any Welsh, Tom?
I can speak a little bit. I'm not fluent, but I can have a conversation.
But it's like I said, it was Tom. It's been a wonderful experience, and we hope, you know, stay in touch, stay friends. We've got nothing but love and respect for you. So from me and the doctor, we just want to say it's been a pleasure, and hopefully we'll see you. You know, we'll do another video in the future, maybe, if you fancy it.
The pleasure is all mine. Thank you very, very much for everything you've done for me.
Thank you very much, Tom. You're welcome. Thank you very much. Just support, don't forget to support your existing hairs.
I will.
Not to transplant hairs, the existing hairs. It's very easy. Just make PRP once a year, or I don't know, maybe twice a year. It's very easy and simple.
Tom, if you give us a shout, we'll send you some complimentary Density Plus from the UK. We'll send you through some
Yes.
of our fantastic. Now, our hair complex formula has been devised by Dr.Acar, so it's his own special formula. Tom, I'll send you some over, and hopefully life will be good, man. Well, listen, guys, it's been a real pleasure. Thank you so much, both of you, for your time. I can't thank you enough. Much love to Tom Powell. Much love to Dr. Levent Acar.
Thank you, Mike.
Tom, lovely to see you.
Thank you very much. Same to you.
Thank you. Have a safe time, guys.
Guys,
Stay at home.
stay indoors, and we shall see you all next time live on YouTube, Facebook, wherever you are, Instagram. Bless you all, guys. Bless you all.
Thank you.
Thank you.
Thank you very much.
Thank you very much.